Good evening, Prof. Can you hear me? Hello, Prof. Coronaviruses are zoonotic. Now, this means they are normally transmitted between animals and people. The coronavirus disease is caused by a new strain of coronavirus, that's the SARS, that's SARS-CoV-2, that has not been previously identified in humans. Now, because it is new, it is still being studied as new elements are discovered on a regular basis. On Tuesday, the World Health Organization acknowledged evidence emerging of the airborne spread of the novel coronavirus. However, it is said that it is said not to be as airborne like tuberculosis, measles, or smallpox, for example, which can circulate in the air. Transmission of COVID-19 occurs primarily through aerosolized respiratory droplets, which can spread the virus and can cause infection in others. What does this mean? We'll find out in a bit, but for now, let's let you see the numbers, what the numbers are like today. The global figures of infected cases are 11.8 million, over 11.8 million. The deaths are over 544,000, and we have recovery cases coming up to over 6.4 million. In Nigeria, the NCDC reported that a total of 29,789 are infected with COVID-19, and so far 12,108 people have been discharged, while 669 people have died from COVID-19 related complications. This is COVID-19 Myths and Facts. Welcome on board. The World Health Organization says there is a possibility COVID-19 transmission can be airborne, especially in crowded, poorly ventilated settings. This comes after a group of scientists asked a global body to update its guidance on how the respiratory disease passes between people. We have details in this report.
If you prefer to ask your question.
According to WHO, COVID-19 cases around the world has now surpassed 11 million, with more than 535,000 lives lost to the disease. Dr. Tedros Ghebreyesus believes the outbreak is accelerating and the world have clearly not reached the peak of the pandemic.
While the number of deaths appears to have leveled off globally, in reality, some countries have made significant progress in reducing the number of deaths, while in other countries, deaths are still on the rise.
Responding to reports by a growing number of scientists claiming that the novel coronavirus is airborne, the global body says the possibility of airborne transmission in public settings cannot be ruled out.
These are fields of research that are really growing and for which there is some evidence emerging but is not definitive. And therefore, the possibility of airborne transmission in public settings, especially in very specific conditions, crowded, closed, poorly ventilated settings that have been described cannot be ruled out. However, the evidence needs to be gathered and interpreted, and we continue to support this.
WHO so far maintains that the virus is mainly passed between people via droplets expelled by an infected person when coughing or sneezing, which are then inhaled by persons in immediate vicinity. New reports, however, dispute this theory and claim that the virus can also be present in extremely small droplets which can linger in the air for longer periods and thus infect people who inhale them long after they are expelled by a carrier.
So joining me via Skype to discuss this is Professor Adebola Olayinka. Now, she's the Research and Infections Controller at the World Health Organization. Thank you for joining in, Prof. Now, the World Health Organization acknowledges there is an emerging evidence that COVID-19 can be spread by tiny particles suspended in the air. In other words, it is airborne but droplet-based. Explain this, please.
There's no black to white, clear-cut definition, but I'll just try to explain the difference between what is meant by droplets and what is meant by airborne. Now, usually you get particles in the air. They could be solid and they could be liquid. And these particles are usually formed when you have like air moving over liquid. Now, our respiratory tract is lined by liquid. And so we are inhaling air, and when we're exhaling air, as the air passes over the liquid in our respiratory tract, it brings out some of these particles. And when these particles come out, they could come out in different sizes. The majority of the particles that come out in the form of what we call droplets. And we try to make a distinction between the two, as droplets being larger and heavier, and airborne being smaller and tinier. And so when you have droplets coming out, they are larger particles, gravity acts on them, and so they rapidly fall to the ground. Now, when you have airborne, they are smaller, they are lighter, and they stay suspended in the air. Now, one thing I think we all need to remember about COVID is that this is a relatively new disease. It's just about 6 months old. Each day we are learning new things. Each day the evidence is increasing. And I think that's the beauty of science. Science doesn't make you stay rigid based on biases or preconceptions. And so when new evidence comes in, just so we think in that it's largely spread by the large drops, but now there's evidence also that there's the possibility that apart from the large droplets, we could actually have the smaller ones, which are referred to as airborne or aerosols, which stay longer in the air.
All right, so tell us about the contagion now. Is airborne COVID-19 less contagious as it is?
A typical example of airborne that we have currently is tuberculosis. So being airborne doesn't make it less contagious. For me, I think the implication is more on, so how does this affect our infection prevention control messages? The main reason for really trying to understand how it's transmitted is understanding how to prevent people from getting infected. Now, the fact that it could be transmitted possibly by the airborne route now also emphasizes the reason why we still need to maintain our distancing. Because when a disease is spread by airborne, close contacts are staying together in confined places, staying together in crowds, increases the transmission. And really, in a way, these are still the same messages that we've been passing all along. Avoid crowds, don't stay in confined places, don't stay in congested places. So what implication does this have in terms of transmission? It means that we need to emphasize and we need to enforce these messages more. And it also brings to bear the message about everybody using masks, because then everybody, even when you're breathing, you're bringing out droplets. If you're talking, you're bringing out droplets. If you're laughing, the more forceful your expression, the more you bring out. And of course, the more likely you are bringing out not just the droplets, but also possibly the airborne particles. So when people laugh very loudly, when people sing, when people shout, and of course, when people cough or sneeze, they actually could bring these particles out in their millions. And so it's still an enforcement of the same message in the community. Let everybody put on a mask, so that even when you're talking, you're laughing, you're not bringing out these particles and transmitting it to others. Because right now, we're not sure who has it or who doesn't have it. So if we all use a mask, we kind of control the source and we limit the possibility of transmission. If we keep the distance, we also limit the possibility of transmission. If we avoid enclosed spaces and we use more of outdoors, we increase our ventilation, these are efforts and these are strategies that will help us to limit the transmission, whether it's airborne or whether it's spread by droplets.
All right, so based on what you've said now, if the evidence is confirmed, this would have to enhance our the guidelines for indoor spaces. In other words, maintain what we have now or even enforce the guidelines, so to speak.
Yeah, we need to enforce guidelines. We need to be sure that there's really good ventilation because that is really important. For airborne, we talk about what we call air changes. And air changes is like the air in a room. You want fresh air to come in to kind of drive out the one that is laden with the airborne particles. And then it reduces the chances of people inhaling. So yes, definitely it's going to mean a lot of more efforts on enforcement of a lot of prevention messages more than before. And I think the other side of it is that it's also going to really affect the way our healthcare workers attend to patients because they are actually at much more higher risk than people in the community. So infection prevention are things that we really need to focus on.
Okay. All right. Thank you so much, Professor Adebola Olayinka there. She is the Research and Infections Controller at the World Health Organization. Thank you for sharing your thoughts with us in this regard. And there you have it. Another angle to the novel coronavirus. And like I always say, we look forward to the vaccine that will put an end to this pandemic. We're really looking forward to it. In the meantime, we have the guidelines from the NCDC to abide by. Thank you so much for watching. You take good care and please stay safe.